These are the untold stories of the ER.
Can I please get a Big Mac, a 10-piece chicken nugget, an Oreo McFlurry, a McMuffin, and a Diet Coke?
Yeah, I eat McDonald's every day, maybe even twice a day. I'm just balling out with the budget. Like, I don't really care about it, and I don't work out either. So, I mean, what's the worst that could happen?
All right, we're just gonna go out here and take a left. As soon as we heard the trauma bells coming, we rushed out to the ambulance. We're never sure what we're gonna get. Can you please explain what happened?
We were sitting there watching TV and she started to complain of shortness of breath. And then she said it felt like there was an elephant sitting on her chest. And then she said that her left arm hurt and it went up to her left jaw. And then she went upstairs to go get her phone. I was sitting there watching TV and then I heard a noise that sounded just like an earthquake. And so I went over to see what had happened, and she was laying there unconscious. And so I called 911 right away.
So all the symptoms that you've listed off to me are common symptoms of myocardial infarction. I'm gonna go inform the doctors immediately, but it sounds like we're gonna have to perform an angioplasty.
I always knew that she ate horrible and she never worked out, but I never thought it would lead to this nightmare.
As soon as she came through the doors, we had to rush her into the cath lab to examine the blockage. After further examination, we realized we needed to perform an angioplasty immediately.
What's going on?
Well, your friend has atherosclerosis in her coronary blood vessels, as you can see right here. These blood vessels supply nutrients to the heart, and without it, she can experience a myocardial infarction, which is basically a heart attack. So due to her young age, it's likely caused by a bunch of fatty buildup from cholesterol and unhealthy eating.
So how are you gonna fix this?
Well, we will immediately move her to the cath lab and I'll sedate the patient.
And then we'll take this stent and insert a balloon into it to blow it up in her coronary artery. This will allow the blood to flow smoothly to her heart.
This is also known as angioplasty.
This should prevent a future myocardial infarction from happening. It's always good to practice good hygiene in the operating room. Okay, I'm ready.
Doctor, the patient is stable.
Girl, what happened? You had a heart attack.
Hi, Olivia. I'm Dr. Eckhart.
Nice to meet you.
I'm glad you're in stable condition. So basically what we had to do was perform an angioplasty and open up your blood vessel so that the blood could flow smoothly through it.
How can I prevent this from ever happening again?
Well, you're definitely going to want to lay off the McDonald's, but in addition to that, you're going to want to practice good exercise habits and good eating habits without McDonald's, and you're also just going to want to eat foods that will lower your cholesterol and make sure to keep an eye on your blood pressure. Under the circumstances, I would say that the surgery went pretty well. We got her into stable condition and we were able to remove the blockage and insert a stent.
Through the fluoro machine, we could see the blockage, and it wasn't as bad as we thought it could be.
So we often see cases like this where people come in having pain in their chest and trouble breathing, and it's actually really common. There's around 1.5 million people who experience a heart attack every year.
My mom told me that heart disease runs in my family, but I didn't really worry about it.
after, my myocardial infarction, I started taking my life really seriously. I work out every other day. I try to blow off some steam around here, and it was a real life experience. It was a wake-up call.